Hey, everybody. Welcome back to the You're Not Broken podcast. I am so excited to have Dr. Jocelyn Fitzgerald on today. She is a urogynecologist who focuses on pelvic floor disorders. And I'm most interested in having her on the podcast because I love reading her writing on Instagram. It's like so awesome. So, welcome to the podcast.
Thank you so much for having me. This is such an honor. I'm a huge fan.
When did you start speaking out? Because, I mean, what to explain to the people, like, you're very direct, like, I won't say like cutting, but it's like you get to the freaking point so clearly and sharply that it's just like beautiful writing. And I'm like, okay, I like how she thinks and writes, and I need her on my podcast. So like, when did you start being like, I think I should share this with the world?
Yeah, I will say probably my third year of fellowship, I got really into Twitter, and that was in Twitter's
Wait, you had a
heyday. Like
3-year fellowship?
I did,
What's
yes.
going on?
Urogyn on the
But
gyne
that's 2
side
years.
is 3 years. No,
It's
it's three.
3 years.
It's 3 years.
Okay,
If
so
you're,
4 years. So for all the people who are mathing, who think doctors don't get paid enough, 4 years
yeah,
of college, 4 years of medical school, 4 years of
hmm
OB-GYN residency, and then 3 years of fellowship
3
to take
years of
care of
fellowship.
surgical prolapse and incontinence.
Correct. Pelvic pain, all of those things. I did have a co-fellow who was urology trained. So she was with me for 2 years, but I did 3 because I came out of OB-GYN. So it's like either 5 and 2 or 4 and 3. So it's
Mhm.
about the same. But yeah, my third year of Urogyn fellowship, I was at Georgetown MedStar in DC, very like political climate. So that was sort of helpful and had very supportive people who were leading my department who really encouraged me to basically take the things I was talking about all the time. And they're like, that is so quippy. Like what you said makes so much sense. You should put that online. And I come from a very sort of literary family. I have immediate family members in politics, not anymore, but so just kind of like grew up also in a non-medical family for the
Mhm.
most part. And you kind of think, how can I explain this to somebody who does not understand, who isn't from medicine and wouldn't get how big of a problem this is, or how do you explain it succinctly, but also in a way that will catch their attention? And I'm
I
the
love
oldest,
it.
also, I'll add this, of 8 children. My siblings are, none of them are in medicine. So we have lots of like very quippy conversations. The banter in my family is
Yeah.
very
Oh,
strong.
super
So
fun.
that's when it started. And I was a third year fellow in 2019, 2020. And then when COVID hit, it's like, are we all going to die, or am I going to say the things I really think on the internet? And that's how it began.
I love it. What kind of feedback have you gotten back from it?
Overall, extremely positive. I mean, the internet obviously has shifted in its levels of dumpster fireness over time. So occasionally I'll step in it a little bit, or one time I criticized Harrison Butker for being super sexist and saying that women should get back in the kitchen. And a lot of conservatives found me, and that was not a super fun day. But besides that, I get incredible feedback from so many women. I mean, I talk about a lot of the same things. You talk about the very basics, like how to treat UTIs, how to prevent UTIs, what prolapse is, without beating around the bush.
Yeah.
We kind of like come up with all these, I don't know, pseudonyms for prolapse. And you're like, prolapse is when your vagina falls out. Like, you just got to say it. And then people are like, what? Your vagina can fall out? I'm like, I know no one wants to say it that way, but that
I
is
know.
what it is.
Dude, that's what I say, because people come to me and they're like, my bladder's falling out. I'm like, your bladder's not falling out. I'm like, that's your
No.
vagina turning inside out. And then they're like, why
Yeah.
did my X, Y, and Z, primary care doctor, whatever, tell me it's my bladder falling out? And I'm like, because nobody can say the word vagina.
They don't want to say the word vagina, and they want to make it into a polite thing you can tell your daughter or son who's going to drive you to the hospital for your surgery. Like, oh, my mom's having bladder surgery. And it's
Yeah,
just easier to
bladder
say, but
lift, bladder tuck. I'm
bladder
like,
tack,
those aren't things.
they're
Bladder
not things.
tack, those aren't things.
They're
Not things. And to me, I'm always like the bladder to me is my favorite organ. It's like the kindergartner, right? Like
Love it.
the kindergartner's a good kid. It just lives in a crappy house. So it can act up. But I'm like, it's not your bladder's fault. Your bladder is not trying to leave your body.
No, it's not. It would like to stay where it is.
It would
It
like
really
to
is a
stay.
canary in a coal mine for things that are going on in your body.
It is.
I agree.
Yeah, and then they're
so
like,
anyway, yeah.
they're like, my bladder, I'm going off on bladders now, but they're like, My bladder get better after my prolapse surgery?" And I'm like, "Listen, bladders like living in the penthouse. They don't like living in the basement. You move them up to the penthouse, they might behave better, but they might not. But we gotta put it back where it likes to live."
Yeah. I love that. That's very similar to what I say, but I'm gonna steal that and say the penthouse thing. They do. They're like, "Oh, is this prolapse surgery gonna fix all my problems?" And I'm like, "Well, we will see. It may. It
Yep.
may."
I don't well, I was
But
like, the goal of prolapse surgery is to fix the prolapse. Other things
right,
might get better, but you can have
right.
overactive bladder without prolapse, all the things.
Exactly.
Um,
Yeah, no question.
I love
But I
it.
try
So
to tell people on the internet, I'm like, "I cannot let one more generation go by without knowing this can happen to you." That just makes me so mad. Like
God
when patients come
bless.
in, they're in their 40s, like, "No one ever told me this could happen. I would never have maybe had that vaginal delivery after my C-section, or maybe I would have never said yes to forceps. Like no one told me that this was a thing." And I'm like, it just makes me so mad that we don't tell women, like we don't want to. It's like we think it's like so taboo to be like, oh, birth might not be perfect, and there
Yeah.
are things that might happen to your body as a result. I like can't let millennial women like be like women 25, 30 years older than them who are coming in a little bit. I don't want to say too late, but a
Yeah.
little too late.
I, uh, I had this lady, she had 3 kids. Yeah, she's young, and she had
Mhm.
prolapse. She's effing devastated by it. And
Yeah.
you said something, one of your quips was, "Women have been collectively convinced that pregnancy is a health neutral event. And I'm here to tell you that
Mhm.
this is a tactic used to suppress freedom of informed choice." And my question, I mean, there's so many ways we can go with that, but my question is, do you think if a woman was actually should AKA should we use this as a sex ed thing? Do you think a woman
Yeah.
would choose to not have children because of the risk of prolapse though? Or I don't think they would. I think they'd still have kids. They'd just be better informed.
Exactly. I feel so strongly about this. I talk about this all the time because that is the kind of post that gets me some pushback from like the mommies of the world who are like, I would never change anything. My children are worth it. It's like, that's not what I was tweeting about. That is you feeling defensive. People who want to become parents are going to become parents no matter what. And they will go into parenthood with more information. And in fact, there is good research that shows when you educate people about the pelvic floor outcomes of birth, it actually decreases their anxiety rather than
Yeah.
increases it, which is what everyone thinks. And I will say this, that if learning about prolapse is all it takes for you to say, you know what, I don't know if I think parenthood is for me, then probably you shouldn't have been a parent in the first place. If that's all it takes to deter
Right.
you, I've probably done you an enormous favor.
Yeah. I mean, education's not bad, and it's like, we're not here to scare people. It's like, prolapse is a
No.
legitimate like, dude, Jocelyn, I had, like, a close to 10-pound baby. Like,
Yeah.
to me, I'm like, I better stay on the hormones, stay with the muscle strengthening,
Yeah. It's
keep
serious
everything going
business.
because I'm like, I'm staring down the barrel my mom had a prolapse, right?
Okay.
So I'm like, I'm staring down the barrel of prolapse if I don't maintain.
Yeah, absolutely. You need to pay attention,
Don't get a
like
chronic
to,
cough. Don't start smoking
yeah,
cigarettes.
exactly. Avoid constipation at all
Poop
costs.
smoothly.
No, it's true. It's really,
It's
really is
so
true.
common.
And exactly, if you know that it's something that runs in your family, I'm sorry, hopefully no one listening that I'm adjusting my headphones hopefully doesn't create weird noises, but um if it runs in your family or you had a big baby or you had forceps, like knowing these things can help you take preventive measures. Also, it will teach you what a urogynecologist is or a female urologist who treats prolapse so that if and when you feel a certain type of way, you don't just live with those symptoms for years and years and years while things get worse. You can go see someone sooner. And we know the sooner you see anyone for any medical problem, the better your outcomes will
Yeah.
be.
The amount of women
So
who come to my office after having gone to the emergency department thinking it was a tumor.
yes, yes, thinking they had cancer, having a total panic, having no idea. I had a patient once actually come and think that she was delivering some like twin that was left behind. I mean, I'm not laughing at this. Like her literacy was obviously not great, but she thought it was like the head of a baby.
Sure. What else are you
And I
gonna
was like,
think it
this is,
is?
yeah, like
Yeah.
something, a ball is coming out.
Yeah.
Not the best. So that's why, I think social media is super important because we cannot continue in this way. Like women cannot be going to the emergency room thinking they have cancer when in fact they have prolapse.
Yeah, totally. One of your tweets was best advice for aging women, vaginal estrogen and weightlifting.
Yeah,
Yeah,
that's it. I mean, I
those
tell my
things.
mom, my grandma, I'm like, if you can do these two things, you will avoid UTIs and you will avoid frailty.
Yep.
And with it, like both of those things are risk factors for falls, dementia, cognitive decline. I mean, you could
Nursing home
prevent
admissions.
so many heinous things that happen that people are scared of. These are the things that scare women. Like, I don't want to end up like my mother or my grandmother. I'm like,
It's
you
funny,
could
right? Like,
prevent almost all of it with both of these things.
yeah, I'm sure you get this too, unless your people are very different than my people. But it's like, I don't want that bad shit to happen to me. But at the same time,
Yeah,
I can't believe I actually have to do something.
I
It's like
know.
this attitude of like, and I'm like, you put a seatbelt on every day, you floss,
Right,
you put on sunscreen, right? Like
right.
we do preventative things every day without thinking about it. And so it's like,
100%.
we could just start incorporating these other things in too.
No question. And it doesn't need to be such an overwhelming task. I mean, I don't know how you tell your patients to put their estrogen on, but I'm like, put it on your sink, like next to your toothpaste. Put it on at night before you go to bed.
Mhm.
Or, 20 minutes of weightlifting. I mean, it doesn't need to be this whole thing.
Yeah.
Get some weights online, have them shipped to your house. You don't have to go
Yep.
pick them up, and then
Yep.
find a video on YouTube. I mean, it doesn't need to
It's
be
so
expensive.
easy at this point. Yeah,
Yeah.
absolutely. Let's talk about we're just going to go through your clips because it's too good and it's going to be an amazing podcast. Let's talk quickly about the insanity of no pain medications for IUD placement.
Yeah. Okay. So this is very interesting. And I do, in some sense, want to defend OB-GYNs a little bit on this one because
Defend
a lot of
OB-GYNs
people
for
think,
all of this shit. They didn't
yeah,
create
people,
this
well,
world.
people don't know who to blame a lot of times for like all of women's health failings. And OB-GYNs really, I think, take the brunt of it. Like, we have been set up to fail
Agreed.
in
Agreed.
so many ways with our training, with like the deeply patriarchal structure with which we are like taught and again trained. And it has a lot to do with reimbursement. So the thing that people don't always know is that IUDs reimburse basically nothing.
Yep.
And in general, OBGYN services, especially procedures, actually, I'm going to not pick on urologists, but use them as a counterpoint that like urologic procedures that are done in the office on men and their genitalia are reimbursed at almost 5 to 10 times more.
Vasectomies are a nice gig, man. And we use numbing
Nice
medication.
gig.
And we
Plenty of numbing.
anesthetize it.
Yes, exactly, because the billing justifies the cost of the anesthesia. In women's health, that is not always the case, and you have so many patients to see in the office, and the anesthesia is not always covered by insurance, and the anesthesia is more expensive than the reimbursement for the IUD itself.
Yep.
I'm not saying anyone's doing this on purpose, but that ends up being like insidiously over time how practices get set up. And then you get taught this like patriarchal nonsense that the cervix doesn't have nerve endings, so it's fine. You can just like grab it with a tenaculum, and that's not true.
Right. And
Like,
then the cognitive dissonance of if a woman does experience pain, that must be a problem with her
with
because
her,
usually it shouldn't be painful.
100%. And there's plenty of patients for whom it's not painful. I thought my IUDs were like the most painful things I've ever
Oh my God.
experienced.
My pre-baby IUD was
Oh my
very
God,
painful. My post-baby
like
IUD, I'm
weeping.
like, nothing.
True, everyone says it's so much better. But I took my like nulliparous, 19-year-old sister to get an IUD. I was like, we're gonna pre-med you with ibuprofen, all these things. It's gonna hurt, but it's worth it. I do love my IUD, like now that it's in. She felt nothing. So she's like one of those people, she's like, I don't know why you hyped me up for this so much. It didn't hurt.
You're
But
like,
there's
fantastic.
still so many people that have so much pain. I'm one of them. So that's like a big thing, is like, it is ridiculous. And it's also, you have to think, you're like, oh, is the paracervical block, like the big needle I need to give the block, is it going to take longer and actually hurt more than the IUD itself?
All right.
So in that sense, like a lot of OB-GYNs, I think, are trying to spare women the pain of the block, because the block is almost just as bad as the procedure. Also, like recently, many insurances have literally stopped paying for IUDs under anesthesia. So
Yeah,
we are set
that's
up to
bullshit
fail
in a
in
half.
lots of ways.
It's
It's total
bullshit
bullshit
and a
in half.
half.
Yeah. If men got
It's
IUDs, it would
insanity.
be, lots of anesthesia.
Fuck. Yeah,
So
they throw Super Bowl parties and then knock them out. Okay, women have never heard of urogynecology because first we'd have to admit why urogynecology exists. Tell me more.
yeah. I mean, I do. I feel this is so fun. I feel so strongly about all these
I'm
things.
like
That's why
reading
I
you to you and
tweet
then being
them.
like, here's your stage.
I know if I this is like narcissist paradise is just like being read your own words and then told
And
that
then
they
being told
are
like, you're amazing.
important.
Please tell me more.
But I really feel this way. I really feel like we would all know what a urogynecologist is if we would just admit to ourselves like why we need a whole entire field of medicine basically to, I mean, not everything we treat, of course, is due to childbirth, but a whole lot of it is. I mean, the incontinence and the prolapse, the biggest modifiable risk factor for both of those things is having a vaginal delivery, particularly having an operative vaginal delivery. And so when people are like, oh, it happens every day. You're a urogynecologist? What is that? I tell them what I do. And they're like, oh my God, I did not know. Like, how do those things happen? Say, well, having a baby makes them happen. Like, oh my God, I had no idea. I had no idea. So we would have to, yeah, admit to ourselves that birth is not a health neutral event, that birth, no, even on a from minor to major, almost always causes some type of complication in every single person. Some of them, again, very minor, very worth it. I'm not saying it's not for like
Right.
the
Yeah. You're
beautiful
just
baby
saying,
that you get,
pull back the freaking
but
curtain
yeah, pull back the
of
curtain.
perfectionism. So when
Correct.
you see these Hollywood people and they're like, bounce back in 6 weeks and blah, blah, like, does your
Right.
brain explode in anger
Oh,
when you see
yeah.
that? Because you're like, dude, they're perpetuating the myth of nothing just happened to this body.
Correct. It's so insane. It really is so insane. And I mean, yeah, stuff happens. Your vagina, while it does bounce back in many ways, will never be the same. And that's okay. And there are people that can help you. And that's it. That's just, it doesn't need to be a thing. It just is what it is. That's life. That's the reality of pushing a watermelon out of a very small hole.
Mhm.
And there are things we can do. You just like need to know about it so that people don't feel ashamed or alone when it happens. Like probably once per clinic, someone says, have you ever seen this before? Like,
Right. Yeah. Yeah.
what do you
Yeah.
mean? Like this morning?
Yeah. Yeah.
Like,
Yeah.
of course I have.
Let me clutch
Like,
my
what do you
pearls. You're
think?
my first. Except for I
You're the
trained for a
first.
decade to see you today. Well, I
Correct.
know. Well, yeah, I mean, it's so shameful, right? Because it's like
So shameful.
people feel so broken. And I used to say like, we're unique because we're on 2 legs and gravity and our vagina points to the ground. And then somebody sent me a picture of a cow having prolapse, and I'm like, okay, 4-legged animals can get this too. Like,
Yes, they can. That is true. That's
anybody
true.
who,
People love to tell me about cows with prolapse. Like, did you know when cows have prolapse, you just have to like punch it back in? And I'm like, okay, let's not maybe compare women to
right?
cows, but yes.
Yeah. It happens to many, many different mothers. Okay, here we
Yeah.
go. Women deserve better than OB and GYN being crushed into one specialty.
Ooh, I feel very strongly about this.
So
This should be a
good.
podcast unto itself. I feel very strongly that OB and GYN should be 2 separate specialties. And not because I have like an axe to grind against OB, just because all of women's health cannot be contained into one 4-year residency. Like the surgical and medical management of all of female reproductive biology cannot be 4 years. It just does not make sense. Obstetrics is now like such an advanced practice. Also, women in the United States are so sick. They have
Yeah.
so many conditions before
Yeah.
they get pregnant. I mean, the riskiness of pregnancy, and I know there's gonna be people who say like, oh, pregnancy is over medicalized in this country. Like women used to die in childbirth,
1 in
actually,
8.
since we have started.
Am I
Yeah,
right? 1 in 8. Yeah. 1 in
yeah, it's
8
insane.
for the
But
people in the back. Nor natural is
right,
1
it's
in
like
8
what? It's so
died.
unhinged. I hate when people say stuff like that. I'm like, oh, so what about like if you can't see and you need glasses? Is that not natural? You would have been eaten by a bear like before glasses existed.
Yeah,
Like, what
shoes
are you
aren't.
even
I would
saying?
say shoes aren't natural. What are you gonna
Right.
do?
Shoes aren't natural. Like
Air
what?
conditioning, but childbirth is
Braces aren't
natural, and death is 1
childbirth
in
is
8.
natural. I know, it's so crazy. And there's like so much good public health data that once we started like intervening on things that used to kill women with medical evidence that they started to live, like praised. And so obstetrics is like a huge field. It's very, very complicated. And it needs, it's not only its own, I speak from this from like with a medical, but also an economics perspective. Like not to jump all around, but like I do consider myself to be an expert in OBGYN reimbursement. And the way that we decide in this country how much money gets allotted to each different procedure and each different like medical problem is this committee called the RUC committee, which is appointed by the American Medical Association to decide like how many monopoly money, relative value units, everything gets allotted. And OBGYN only has one representative for all of its specialties,
For
like
all the
all of its
humans
high risk
born in this
OB,
nation.
correct, all of it for all the people, and then like all of the infertility, urogynecology, GYN oncology, and all of like the endometriosis surgeons are represented by one person. And many people may not know that that the Social Security Act put forth this thing called a budget neutrality clause, which means there's a finite number of dollars that can be spent on all of healthcare every single year, and you can't really shift them around without like a real act of Congress practically. So OB-GYN was like given this very small sliver in the early 90s and has never been able to overcome that. So OB and GYN are like fighting each other over this really small amount of reimbursement. And if they had like separate representation from being two different fields of medicine, we would be able to fix a lot of public health problems like labor and delivery units closing all over the country. Only 1 in 2 counties in the United States has a labor and delivery unit, which is so insane. I mean, women, it's just crazy how far women have to travel to deliver a baby. But like, we can't really fix that problem because of how little they're paid to keep those units open.
Yep.
So anyway, economically, we need to have like representation, 2 separate people on this committee, but also like to take all of OB-GYN and be like, there's not enough room in modern medicine for 2 fields of medicine that deal with women. We're going to have 1. And that happened at where I did residency at Johns Hopkins over 100 years ago. There was this like cat fight basically between the chief of gynecologic surgery and the chief of obstetrics. And the chief of obstetrics, his name is John Williams. He writes like, you know, our major textbook in OB is still named after him. And he didn't want to be called a man midwife anymore. People were making fun of him and being like, you're a man midwife, you're a man midwife. So in order to give himself like more legitimacy, he felt surgically, he became the chair and then took over the gyne department. But till this day, and at Johns Hopkins, fun fact, it's called the Gynecology and Obstetrics department because that was like the deal they brokered to put them together, is that gynecology still had to be first. Whatever. It was just like a bunch of men like fighting over nothing. And they basically decided so that Williams didn't have to be called a man midwife anymore, that OB and GYN were going to be the same field, which is wild. And so then women get this like subpar care. We're expected to learn all of obstetrics and then all of gynecology and all of like menopause medicine and all this stuff that really is a full body condition.
Oh yeah, and all the cancers. Uterine cancer, ovarian cancer, breast cancer screenings, cervical cancer screening, vulvar cancer screening, lichen sclerosis expert, and don't forget all of the hormones that happens to 100% of women around age 51.
And all of the sexual medicine.
Oh yeah,
all
also
of the anatomy,
you're supposed to be taking care of all the sexual
surgery.
medicine.
Correct. It's nuts. And then women understandably are like very angry at us. They're like, why aren't you fixing all my problems? It's like, well, first of all, there's only like at best 9 of us per residency per year, and we get split 9 different ways into 9 different specialties. And there is no like fellowship in sexual medicine, and there really is no like special training in menopause medicine. Yep. No one really owns that. OB-GYNs aren't walking around going, oh yeah, I know all about like, you know, musculoskeletal syndrome of menopause. Like, I have no idea like why your shoulder hurts all of a sudden. But it's estrogen driven, but we're not taught that.
No.
And neither is ortho, so no one knows.
Right. Yeah, totally. I mean, when I started this journey 6-ish years ago, I was, talking on social media or something. A gynecologist called me out and said, she's just getting into menopause. And it was a fuel under my fire of, excuse me? Everybody needs to get into menopause. You guys can't do it. And for anybody to put the burden on OB-GYN for hormones is insane. You can't do it. I'm like, we need neurologists, cardiologists, GI people, oncologists, the ortho people, primary care everywhere, internal medicine everywhere. The endocrinologists.
Isn't that their whole job? Hormones?
The endocrinologists in my town don't see, air quotes, sex hormones.
Yeah, no, neither do they in Pittsburgh. I don't know any.
Yeah. But to me, I'm like, listen, gyne, if you need to share the load. And to me, I still have a chip on my shoulder. I'm like, it was a gynecologist who said I'm getting into, and I'm like, damn straight, I'm getting into.
Yeah.
we
I
all
couldn't
need to
disagree
get
with that more.
we all need to get into. Okay, here we go. To all the firstborn, this one particularly hit
Ah!
home. To all the firstborn daughters, how's your career in healthcare going?
Are you a firstborn daughter?
Damn!
You
Yes.
have big first daughter
Do I
energy,
have big
so
first daughter energy?
you
Don't
do.
it's like my energy is like, don't fuck with me and don't fuck with my tribe.
Yeah, exactly. I told you at the beginning, I'm the oldest of 8 kids. I don't know. My mom's pelvic floor is doing really well, which is shocking. Uh, but my youngest brother's only 10 years younger than me, so we're all really close in
Holy
age.
bananas.
I know. But like my nickname growing up was Bossy Jossie, and that is just,
Yeah, you needed to
you
like
know,
maintain order.
I did. So yeah, we're caregivers, but we're also we have leadership potential and have been tasked with, we're very type A, we're very organized.
Yeah, I
We
see
have
it.
very
I see it
little.
in my firstborn daughter. I'm just like, damn, I'm raising myself.
Yeah.
Uh,
Well,
no, I love it. But on the dark side note of that, I think health, because of how toxic healthcare is and the burden, like somebody was asking me today about it, and I was like, listen, current healthcare will eat you up until you die or leave from getting sick. And I'm like,
yeah.
I needed to get out before I got sick. Thank
Yeah.
God thank
Yeah.
God I left healthy. Right? Of like,
Absolutely.
healthcare at this point is fraught with harm.
Yeah. It's really hard to be a doctor if you don't have good boundaries and like
Mm.
happen to work in a place with people who are protecting you or in the positions where they can do that. I feel uniquely lucky that I mean, but there is still nothing is perfect. Like there
No.
every day, I mean, I have issues with so many things. Insurance, sexism, women's health problems, like many plagues.
Insurance not covering shit. Okay, here we go. By
Yeah.
2050, 4.9 million women will have symptomatic vaginal prolapse. 15% of women will have prolapse surgery in their lifetimes. There are currently 1,000 urogynecologists in the United States.
Yeah, it's not good. It's pretty dire. There's one urogynecologist for every 100,000 women in the United States. And I know it's crazy.
I would. I don't know this. Maybe you do, but do you know the percentage of urologists who perform prolapse and incontinence surgeries?
I do not know that number, but
It's less
I
than
do know that
50%.
it's disturbingly low.
Probably
I mean,
probably 20% or less of urologists. There's 10,000 urologists in the country. There's 1,000 female urologists ballpark in the
okay.
country.
Yeah, there has been a study that came out recently, where they compared basically procedural counts between like urology focused urogyn fellowships and then gyn focused urogyn fellowships. And the urology focused urogyn fellowships, unsurprisingly, maybe did a lot less prolapse surgery. They did a lot more like complex neuromodulation, a lot more neurourology, a lot more like complex urethral reconstruction, like
Yeah.
diverticulums and buccal grafts and that kind of stuff. So it's, I think, decreasing, and I think that's also a big reason. I remember being told, I was very torn between urology and
You act
OB-GYN
like
because
a
I knew.
urologist. I'm like, how did
Thank
the
you.
sorting hat put her over there?
It's very interesting that you ask. I was very, very torn. I did my research here in a urology lab, and I never wanted to do OB. I like am not, pregnancy is not for me. I knew I wanted to urogyn. I asked like some urologists, like a female urologist, this woman named Liz Sagan. She was, I think, a pretty legendary female urologist in Pittsburgh. And I was like, what do I do? Do I go to urology residency or OB-GYN residency? And she told me to go to OB-GYN residency if I wanted to take care of women, just because she didn't feel like she got great training in how to take care of women.
Mm-hmm.
But she did also say, like, you'll get paid less, you'll have to deal with like some misconceptions about your surgical skills, perhaps like some other things that I really had to sort of come up against and still sort of try to fight against those misconceptions online. But I mean, yeah, it's a tough road to hoe. There's not very many of us, and we do the number one surgery that women get over the age of 65 in the United States.
Prolapse.
Prolapse.
Before, it used to be hysterectomy as the most common surgery. Has that changed?
I believe that hysterectomy still is the most common surgery that women get, and then followed by a C-section. is the
Sure.
second most common surgery that women
That's
get.
a
And
surgery.
everything,
Fair enough. I wasn't thinking
yeah.
about it.
I know people don't think of it that way, but it's a laparotomy. I mean, it's a big,
Yeah.
women often
Yeah.
forget. I'm like, have you had any surgeries before? Do you have any scars in your abdomen? They're like, no. And I look in their chart. I'm like, well, you've had 3 C-sections. And they're like, I didn't think of it that way. So I'm like, I still got to get through those adhesions.
Right? Yeah, yeah. It counts.
It
Uh,
counts.
okay, here we go. If you come to this one, it was also speaking to me. If you come to my office, you will be leaving with a prescription for vaginal estrogen and pelvic floor physical therapy. Yes, boss. I was just talking
I've
to somebody
fixed more
today
women
about
with
that.
those 2 things
I'm like,
than
I think
anything
it's
else.
messed up that people get to the surgeon having tried
I know.
nothing.
Having tried nothing.
And they come to see me and they're like, but I don't want surgery. I'm like, why are you here?
Right. They don't know that
No,
you're
they don't know.
a surgeon. They just know that you're a woman who sees vaginas. So yeah, you probably face that too. It's like, oh, they probably ask you to do their pap smears, which maybe not, but I get asked all the time. They're like, oh, can you do my pap? I'm like, no, I'm a pelvic surgeon. I can't.
Yeah, no, I mean, to me, I'm like, do you think the whole debacle? So when I trained at the very tail end of pelvic mesh kits, and then I trained. So half of it was putting pelvic mesh kits in. The second half of my residency was pulling out pelvic mesh kits. And to me, I'm like, dude, first rule of surgery is have a healthy tissue, right? And I'm like, nowhere was it these people needed to be on vaginal estrogen before. Nowhere was it that these people needed to be on vaginal estrogen after you put mesh in the vagina. Like, how much would be prevented if we kept the tissues healthy in the first place instead of let them become atrophic and erode?
Yeah, that is a really good question. People have done dabbled in that study. They've done that study recently. Like a pretty good RCT came out about if vaginal estrogen helps outcomes of prolapse surgery. Like if you randomize people,
I saw
turns
that.
out it actually does not.
I think it was, but my argument for that was there were very short studies. I'm like, you do that study.
Very short.
Yeah, I'm like, you do that study for 5 years, you'll see that vaginal estrogen is going to win. It was too short.
Yeah. And those are also post-op patients. Those are people that's hugely confounding. Like these people already have gotten prolapse and have not done well. I mean, I think, yeah, absolutely.
I think even if you get a sling, if you get a mesh sling for incontinence, you better be on vaginal estrogen for the rest of your life. Keep those tissues healthy.
Yeah. Yeah. It's very interesting. I want very much to 100% agree with that. And I do, but being premenopausal when you get a sling is a risk factor for an exposure. Not because I think it's because your tissue is almost too healthy, if this makes sense. The argument that the mesh experts make is that the stiffness of the mesh is more similar to the stiffness of postmenopausal tissue, so that the stress shielding forces that it sees are more similar than stiff mesh on soft well estrogenized tissue, and that you actually might need to be using a different weight or different type of sling in a premenopausal patient who is well estrogenized. And probably same thing for a postmenopausal woman on estrogen. I wouldn't be surprised if we need to come up with a better device.
Yeah.
But yeah, it's almost like the atrophy is good for mesh because the mesh is also
they're thin,
stiff.
Oh, yeah. That's fascinating. That's super. Yeah, I mean, with in my experience, the sling mesh exposures aren't on vaginal estrogen.
I'm sure that is
it's got to be there.
And also they're so rare in general. If they're put in by someone
rare.
Who knows what they're doing, they're rare.
Pretty rare. Okay, being a urogynecologist is a radical feminist act in a society that abandons and discards women after they have given birth. That's badass. You got to keep writing.
That's it. Thank you. I mean, I feel very strongly about that. I mean, it's true. All the money we spend on research is always on pregnancy. I mean, the NIH spends less than 10% of all of their money on women's health, but of that 10%, 80% of it, so 8 total percent, is spent on pregnancy and pregnancy-related disease, which leaves 1 to 2% for the rest of a woman's life. Women are only pregnant 2 to 3% of their lifespan, depending on how many kids you have. So it's just so insane to, you spend most of your life postpartum. People think postpartum is 6 weeks after your baby, but I mean, 2/3 of your life is postpartum. So I think it's a radical feminist act to be like, you know what? We care about women once they're done being a vessel for the state. Like
Yeah,
now that their baby has left their person, like we need to
right.
still think of women as people.
The
And that's
next
what
decade
Eurogun
of
does.
the next generation of tax revenue has been created. Thank you very much.
Yeah, exactly. It's just so crazy. And yeah, it does. I mean, Eurogun, it restores the economy because women are like the biggest drivers of the economy. You get a woman who's incontinent or has prolapse, like out of the house, back to her job, back to her church, back to her community, back to taking care of her kids, back to her sex life, like all these things that like are literally tied to the economy, to women's like financial independence, but also the general like health of their families and the things that make economies great. Like Eurogun does that. We
Yeah.
we put women back where they belong intact.
Well, then, I mean, the number one reason for admission to nursing homes is incontinence. And why
Right.
are we falling? Because we're getting up at night to pee,
Correct.
right? Like,
Exactly.
it's profoundly important.
Profoundly important.
Let's talk
And we
about
get all these UTIs.
oh God, yeah. You know, it's Rachel Rubin says it the best of like, vaginal estrogen will save your life.
It will save your life.
Because you can die from UTIs.
Look at that breast cancer study that just came out. The women who were on vaginal estrogen versus the women who were not. The women with breast cancer who were on vaginal estrogen lived longer than the ones who were not on it. And I tell my patients the reason for that is probably because they weren't dying of urosepsis.
Yeah, totally. I love it. Let's talk about the projected deficits of OB-GYNs. Are residency spots even filling at this point? I know they're not filling in Texas.
My understanding is that that's interesting. Yeah, there definitely has been a shift in like the applicant numbers to red states, but that's also across all medical specialties. Like any woman and many men who are, partnered with women in medicine are not trying to be of reproductive age in a state where they can't control their body and their reproductive future. But OB-GYN remains an incredibly competitive and popular specialty. I do think where people apply is going to shift. But yes, I do think that residency spots are still filling. It's just that now these programs have to like ship their residents to other states to get abortion training because you can't like be an OB-GYN without abortion training. Like
Right.
someone comes in like hemorrhaging and they're 12 weeks and their cervix is dilated, but there's still heartbeat, but they're bleeding and they have a fever. Like,
Yeah,
you don't
need
know
to
how to
save the
do an
life.
abortion. She's going to die. Like,
Yeah.
what are you even talking about?
Yep. Yeah, it's so ridiculous.
Yeah.
You had done one other thing about like if legislatures, senators, like people who made the law, followed a gynecology resident around for 24 hours to actually see what happens in a hospital.
That's right.
And see what you're making laws about.
Yeah, I did. I mean, people don't like to think of it as abortions, but I probably did one abortion per shift when I was a resident, just because that is this. If you're going to have sex and get pregnant, planned or unplanned, wanted or unwanted, the complication rate is so high. The threatened miscarriage rate, the bleeding rate, the infection rate is so high. Pregnancy is so complicated. So many things can go wrong, and they do go wrong all
They
of the
go
time.
wrong all the time. Yeah, that's like when
all
it goes
the
right,
time.
be like, oh,
it's a miracle.
It's a miracle.
It's a miracle when all of us that walking around are miracles because something went right in like the fusion of this sperm and this egg that then grew into a person. Like,
yeah, and you didn't kill your mom in the process. Good job.
Correct. We didn't kill our moms. I mean, it's a miracle. But
it's a miracle.
you would have to see the reality of it. You just like got another page. Oh, another lady is down in the ER. She's pregnant. She's bleeding. Like again and again and again throughout the whole shift.
Yeah.
Your pager just explodes.
I want to leave women with, because women are like, okay, we're angry, we're pissed, we want to do something. My advice is always talk to your senators, write to the FDA, talk to the people who control the money, because being pissed in your kitchen with your friend doesn't change any of this. Would you offer up any other thoughts on action and what to do?
I really do like what you said about following the money. People like really don't like to talk about money, but unfortunately we live in capitalism and money is the only thing that matters. So yes, follow where money is going to decide like if whether or not your reproductive rights are being parlayed as some sort of bartering chip for another piece of legislation that people are trying to push through. Obviously, vote like your life depends on it, because it does. But like, also be educated about reproductive biology and the laws where you live, and have a contingency plan. I mean, stock up on abortion pills. I know that like there's some, whether you should or shouldn't do that is like, you don't want to gobble them all up and then not have them be available for people who need them. But I think at this point, like we do have, you know, a lot of them. And then, I mean, I don't know, this isn't going to be a podcast about like the 4B movement, but like don't have sex with men who are going to like not support your reproductive choice, you know?
Yeah.
It's not the best solution, but I mean,
these are things I stay up at night thinking about. I'm like, and maybe this is my urologist brain, but I'm like, tell me you've thought about this. I can't wait. I better be alive, because I need to see how the world's going to change. When we finally get a reliable, reversible male birth control, the world will change. I don't know how it's going to change. I just know when 100% of people are involved instead of 50% of people, the world will be different, and I want to be alive to watch it.
I know. Same. I do too. I always said I think like the vast majority of the world's problems would go away if every time a man and a woman had sex, it was a 50-50 chance as to who would wind up pregnant. If it was, you just rolled the dice and it was like either one, 50-50 chance. Someday it might be the man this time, might be the woman this time. It would fix like all the world's ills.
That's
but
so
unfortunately.
That's awesome. What are you gonna do with your writing? Do you got we're gonna do this for a while? You got some books, you got some speaking? Where can people find you?
I do a lot of speaking. Obviously the internet though is not great. Like Meta is not doing great. There's a lot of oligarchy men who are in charge of all of our social. I wish there was like a woman-owned social media platform.
Dude, Instagram, like I'm like, you can't say body parts. That's why podcasts are so great, because I can say vulva without being screened.
No, yeah, maybe. I mean, there's so many great podcasts. You've done such an amazing job. It's like a hard, anyone with like a mic and an opinion, you know, there's a lot of, not you, a lot of people who have podcasts. So it's like hard to kind of crack in there. But I think if you have something important to say, that people gravitate towards that. So yeah, maybe I've often thought about maybe writing a book someday. I mean, I'm still a very busy clinician. I'm, you know, 70% clinical. I take care of a lot of patients. So yeah, I don't know. We're going to see how social media pans out. I'm working very hard with like an incredible group of people from DC, from McKinsey, lawyers from BU and Harvard. We're really working hard on this like gynecologic surgery reimbursement thing. So I've been throwing like my heart and soul into that at the moment. But yeah, I feel like the path forward will declare itself. Yeah, I mean, I do write things all the time. I write a lot of like JAMA opinion pieces and have a lot of, you know, people who invite me to, like you, to be, I'm very grateful, like be heard by their audience and their platform. So we'll see.
Well, keep writing, because it's brilliant, and I support you 100%.
You're so kind. I love everything you say too. It makes me sometimes really laugh out loud. Like, this is so good.
That's how you get adults to learn, right? You get an adult to laugh, you got them.
Tremendous.
That's my
read
secret,
not
people.
To like shift around, but yes, humor. I read this amazing article that for a woman to seem both likable and competent, unfortunately, the answer to that is humor.
Yep.
If you're funny, people think you're those two things.
Yeah, exactly. Well, I'll keep working on my stand-up routine.
Yeah. Oh no, you're doing great.
Thank you so much.
The Netflix special.
I know, we're manifesting it for sure. Thanks so much for joining us today.
Yeah, thank you for having me. Anytime.
A pleasure.